So hello there and welcome to Cocoa Pods, a podcast of the Broad Center for Natural Deliveries Foundation. Today we are very, very fortunate to have CDC's Dr. Larry Sperling with us today. My name is Dr. Bola Sagade. I'm the host of this podcast. Yeah, so thank you. So for my patients out there or women out there, basically Dr. Sperling is saying that the CDC is helping, is looking into this problem and helping. But I want to talk a little bit more about your bio. I started by saying that, while serving as the Million Hearts Executive Director, you continue to see patients and remain an active member of the Emory faculty as a CATS professor in preventive cardiology and professor at the Rollins School of Public Health. You have been voted one of America's and Atlanta's top doctors and appeared often on local and national TV, newspaper, radio, and magazines. In 2011, you were chosen as one of the 20 national dietary experts by the U.S. News and World Report to evaluate and rank America's popular diets. You have received awards for excellence in both teaching, including 4 Golden Apple Awards and the Dean's Teaching Award, and also mentorship. So thank you for having medical students with us today listening along. And you did talk about the CDC's Hear Her campaign, because indeed, diagnosing heart conditions in pregnancy can be challenging because the overlap of cardiovascular symptoms with those of normal pregnancy may lead to delays in diagnosis and in subsequent care. Studies have actually shown that if cardiovascular disease, heart disease, were to be considered in all the things, the differential diagnosis the treating healthcare provider was thinking about, it is estimated that a quarter more mothers dying could have been prevented. So thank you for mentioning all the things the CDC is doing. The Hear Her campaign, listen to the woman, listen to her complaints. And this is more even to healthcare providers now. And so there is a woman out there, Black or minority in some way, thinking if minority celebrities are at risk, what chance does everyday regular or low resource Black people have at healthy pregnancies? How can we inspire and build confidence to create behavior change related to heart disease and stroke?
Yeah, this is part of the work of Million Hearts 2027. Million Hearts 2027 is all about partnerships and collaboration. But the most important partnership and collaboration is with those at risk for cardiovascular disease or people living with cardiovascular disease. We certainly want to create a togetherness. And so it's about the we, not just the me. And here, Million Hearts, for the very first time, along with the CDC Foundation and other partners, has launched the very first forward-facing campaign, several campaigns, in fact. One of these campaigns is called Live to the Beat, and I encourage you to look at the Live to the Beat website. And also, I would encourage your listeners to join in with Live to the Beat, because it's a campaign focused specifically on raising the awareness of heart disease risk in Black adults ages 35 to 54. But it's way beyond just raising awareness. It's about empowerment, understanding, and action at the level of individuals, families, and communities, recognizing that along with healthcare professionals, you can address key heart-related risk factors like high blood pressure, high cholesterol, and blood sugar. And you can take small steps, and these small steps can lead to big changes and significant reductions in risk. So although most Americans, unfortunately, are at risk for heart disease, which even in the midst of a pandemic remains the number one cause of death in our nation, even though most of us are at risk, a lot of the risk can be changed. So the Live to the Beat campaign has a lot of energy, a lot of excitement, and a lot of engagement. And so it would be wonderful for your listeners to embrace this and join in. Another related campaign is called Start Small, Live Big. This is more focused on older adults, age 55 or older, to get back on track with their small steps. The importance of scheduling their regular medical appointments, being aware of their heart-related risk factors, getting active, eating healthy, and again, reducing their risk of cardiovascular disease.
Well, thank you. And there's one more initiative that the CDC is actually doing, which I like, the Release the Pressure campaign that seeks to empower Black women in taking preventative action to protect their heart health by encouraging them to be a part of a healthy blood pressure movement. So we want to encourage women to also go to Release the Pressure campaign by the CDC. So thank you so much, Dr. Sperling, for that. 1 in 5 Americans live in a rural community, including approximately 18 million women of reproductive age. So it is critical that the federal, regional, state, and local agencies and communities work together to improve access to high-quality maternal health services in rural communities. How can local communities get involved in health education and promotion? And you did talk about this some before, but just to emphasize how we can get involved.
Million Hearts is about partnerships between public health, clinical care, but it's also about partners at the community level. And examples at the community level are some of the Million Hearts partnerships, for instance, with the Y's of America, which are often located in smaller rural areas. But in these small rural areas, campaigns like Live to the Beat, Start Small, Live Big can provide this information. The CDC as well has the ability for all Americans to raise questions and engage the CDC website and encounter live individuals who will bring these questions back to experts at the CDC. So the CDC is listening. We definitely want to be able to answer questions that are brought forth. And we want to see a healthier America. And Million Hearts, it's all about the possibility of preventing 1 million heart attacks, strokes, and cardiovascular events. But this begins with preventing one event at a time.
Wow, thank you. Freestanding birth centers accredited by the United States Commission for the Accreditation of Birth Centers are a high-value option for maternity care and complement the existing hospital-based system. Care that is provided by birth centers fully meets the triple aim vision of healthcare, that is, improving the experience of care, improving the health of populations, and reducing per capita cost of health. The CDC, the nation's premier health promotion, prevention, and preparedness agency, is headquartered approximately 75 miles from the Birth Center for Natural Deliveries in Forsyth, Georgia. How can we benefit from this great institution? And again, I know you talked about it some, but can you recap on how birth centers and other institutions can benefit from the CDC?
Yeah, thanks, Dr. Salgado. The CDC, as you said, is located 75 miles from the Birth Center for Natural Deliveries. I guess 75's a theme because this is also the 75th anniversary of the Centers for Disease Control and Prevention. The CDC's reach, though, is all across the nation and all across the world. Trusted experts in public health. As I mentioned earlier, though, the CDC is available to all. There's a CDC Info, which is a national contact center and publication fulfillment system. And CDC Info offers live agents by phone and email to help find the latest reliable and science-based health information on more than 750 health topics. The CDC Center for Chronic Disease Prevention and Health Promotion has various divisions. And the division I work with is called the Division for Heart Disease and Stroke Prevention. Another division, though, is the Division for Reproductive Health. And it's dedicated to improving the lives of women, children, and families through research, public health monitoring, scientific assistance, and partnerships. The DRH, activities and programs support to organizations, institutions, clinicians, and consumers across the U.S. and around the world. So the DRH is in your backyard, and the work you're doing, of course, is very much in support of clinical care, public health, and healthier communities.
Thank you. So I just want to say that the Million Hearts, we have Dr. Larry Sperling here with the Million Hearts. And this initiative, like you said, indeed provides a repertoire of evidence-based strategies and resources for clinicians like me and public health professionals and patients with the aim to prevent 1 million cardiovascular heart-related events in 5 years. So, Dr. Sperling, thank you so much for coming to this podcast today. And I have one more question for you in closing. You have been a marathon runner. You have completed the New York, the Prague, and Atlanta marathons. In 2010, you ran the original course from Marathon to Athens, Greece, to celebrate the 2,500th anniversary of this event. So I've tried to run a marathon. How do people train for a marathon?
Yeah, first of all, I do want to thank you again on behalf of our Million Hearts team, the Million Hearts partners across the U.S., and the Million Hearts Initiative for the invitation and opportunity to join you today to have this conversation, a really important conversation for your listeners. You mentioned during the course of our conversation about various recognitions and awards that I've received. The most important recognition, as you know, for the work you do and the work I do, and the most important rewards are helping to build healthier communities, improving care. And for me, the most wonderful thing to do as a preventive cardiologist is to prevent a heart-related event in somebody that has a significant risk. For me, that's the biggest success. So coming back to marathons, I think that question is very, very apropos to our conversation today, because health promotion and disease prevention is not a sprint. It's very much a marathon. And it's a marathon for individuals living with risk or disease. It's a marathon for us as clinicians. It's a marathon for the partners out there that are working very hard to make a healthier nation. And what's training for a marathon, and how can we apply that to our discussion today? It's all about preparation. It's awareness. It's physical and mental, but it's also about resilience and perseverance. And although a marathon, you might think of that as an individual event, it's very much a team approach. So it does take partnership. It does take a team. And your listeners may not be training for marathons, but I'm going to come back to the CDC Foundation Million Hearts campaigns. Living to the beat, it's about living, it's about learning, it's about action. And each and every one of us can take some steps forward to be healthier. Those steps make a difference. And I hope your listeners today have embraced the importance of what remains the number one cause of death in our nation, the impact of this on women who we would think would be healthy going through pregnancies, but there are preventable events, and we want to prevent these events together.
Well, thank you so much. For our listeners out there, we've been talking to Dr. Larry Sperling from the Million Hearts Initiative with the CDC. And I just want to thank you so much for your time. I know that there was a team behind this, so I want to make a special mention. Thank you, Jacqueline. Thank you, Booker. Thank you, Tracy. I just want to thank you so much for the information that women can use to live healthier and prevent, one of the major causes of problems in pregnancy. Thank you for your time this morning, Dr. Sperling.
Thank you again. It was really, really an honor to join you.
Thank you.